Good morning. Today we want to take care about mental illness diagnosis. Well, diagnosis that's very crucial. Not only in mental illness, mental problem areas, but actually to all places. We need to diagnose our body, mind, and mental, and spirituality too. We need to diagnose, um, our performance, what we are doing. I mean, that's kind of a narrow concept compared to evaluation, um, and the conditions and all other things. So if you don't know what's going on, you cannot take care of it. A medical doctor I know, he's a well-known medical doctor in Korea. He actually, one day confessed to me that it is more harder than before. The more he studied, the more he has more experience, the more difficulties he has. Because not only him, but all other medical doctors are about the same. Because, you got cut here, that is kind of easy to take care of it, right? Put some, sterilize it and clean it, sterilize it, put some ointment, maybe stitches. But what if the person got cut by something else? Now, is it just a scratch or cut by a knife or cut by a rusty nail or cut by a metal or any object which contaminated by certain poison or certain poisonous chemicals? Then depends on the condition. Medical doctors have to think about many other things. Can medical doctors, just put some ointment and that's it, or band-aid, or if the cut, happened by a poisonous or poison related contaminated, chemicals or any other things, object, and then the doctors have to do more than that, right? So, and what about the cold? Once you caught a cold, do you really think there is a cold or flu or coronavirus? Symptoms are similar, but in most cases, patients don't know what's going on, or they just believe that it's a common cold, or it must be a flu because I got, too much severe fever or sore bodies. Well, you cough a lot and you got high, you got fever. What if there is a coronavirus? So it takes time, and the medical doctors have to do, take some more steps to figure that out. What is the real problem? Well, cold itself has, many things to think about it, think about, but what about the mental illness? It's about the same. I mean, you feel melancholy or you feel depressed, you got too much stress, but it's hard to say, oh, you got a depression. You take some, Prozac or any other medicines, any proper medicines. Take a rest, try to release your stress. But is that all? Really? So the doctor I know, he told me that diagnosis is the most crucial because unless he cannot, subscribe any medicines for that, he cannot try any proper treatments with confidence because he does not know what's going on to his patients. So diagnosis is very important. Well, bridges are falling down like the London Bridge. London Bridge falling down, you know the song. Well, some bridges fallen down for last many years because of the wind, because of the water, because of the rust. So, if you go and see the Golden Gate Bridge in San Francisco, you can see all the numbers on each wires and on each metal beams, on each, I don't know, many other things. There are so many numbers. If you see them carefully, almost all parts have numbers on it or sections. And then they check them out very often. Or they're gonna lose the bridge and then they're gonna lose lots of lives because of that. Well, that Golden Gate is famous for jumping down, for suiciding. That is kind of sad. Jumping down out of the beautiful bridge, that's sad. But that bridge is famous for suicide. Well, the city doesn't diagnose for securing the jumping bridge. No, it's for everybody's safety. And at the same time, why they are trying to figure that out, why people are jumping out of the Golden Bridge, why the bridge is famous for. What problems, push them to jump down out of the bridge? Well, there are so many things regarding the diagnosis. So diagnosis is the very first step. And for the diagnosis, people, the medical doctors, consultants, city management, and bridge care staffs, they have to check so many other things and try to figure that out and then before they diagnose it, okay, this is the rust problem, okay, this is the stress problem, okay, this is the cold. It's not flu but cold. It's not COVID-19 but flu. They have to check it out and test them out, so many things. the mental illness, we cannot just say, oh, you have a mental problem. Then what kind of a mental problem you have? If we don't know what kind of a mental problem your patients or your clients have, then it's going to be very vague. Your counseling approach and your medical approach, those can be very, different. Okay, so diagnosis is it's kind of very important. It's the very first step, but for the very first step, we have to deal with so many other things until we reach diagnosis. Okay. So mental illness diagnosis is kind of tricky. So it's pretty hard. It's pretty hard. So there is DSM-5, or I just studied with the DSM-4, but later on DSM-5, maybe they have DSM-6, or I'm not sure, but I saw DSM-5. DSM is diagnosis mental disorder, right? That is kind of a thick book, and it has lots of mental disorders in the book, and and then each mental disorders, in each mental disorders, it has lots of categories for diagnosis. Six standard 1, 2, 3, 4, 5, 6, something like that. For example, well, I'm not looking at the book right now, but for example, if you want a diagnosis as depression, you feel melancholy, you are depression. No, it doesn't work like that. In DSM, the mental order diagnosis, mental order, mental disorder manual. That's for the depression. There can be lots of symptoms like sleepless or sleep a lot, or cannot control the normal work. You cannot go working places. You cannot concentrate. You eat a lot or eat less. There are lots of standards, and if your clients meet, for example, at least four symptoms for 2 weeks or 4 weeks, depends on the mental disorders. So your clients doesn't need to meet all of them. Well, you can see that kind of a client. That in that case, that's definitely depression. But for the diagnosis, okay, you have depression, and your clients have to meet, for example, at least 4 symptoms for 2 weeks or 4 weeks or 2 weeks, something like that. Okay? Because one day you don't want to go work. It lasts just one day. Then you cannot apply that kind of symptoms for diagnosis depression. No. Okay. One day you wanna eat a lot, so you eat a lot. But it lasts just one day or 1 week. It doesn't work like that. So it takes time. So you want to watch what kind of symptoms and how long those symptoms last. Until you see all of them, you cannot say it is a depression. But those symptoms can be happened in other mental disorders. Okay, maybe schizophrenia. Okay, maybe obsession. So some of them, or some of them can be happened in those mental disorders too. Then how to discern, how to see the difference between those mental disorders with depression and how you can say that is the depression. So DSM, that is manual for diagnosis, and it is taking care of lots of mental disorders in there. It is pretty difficult. Okay. And when I was in master program, I just learned the DSM at the time, DSM-4. There is another workbook. So it shows the case, and you read it, you analyze it, and you just try to find right mental disorder for the case. Okay. Well, that kind of training, education, and practice is pretty crucial. So, because we don't want to say, oh, you have depression, you have schizophrenia, you have compulsive obsession or something like that. All right? You have anger. Well, anger management disorder. Okay. Well, so diagnosis is a pretty hard part, but we have to desk it in our hands so we can find right diagnosis, and then we can provide better counseling and right medicines and right treatments. Okay, so diagnosis is very important. Well, your client can have depression and compulsive obsession, or those can be happening. You know, there can be multiple diagnoses on your clients, depends on the situation. So even you find the right diagnosis for your clients, you have to double check so whether and then make sure whether your clients have that problem or plus other things. And then you want to just try to see the relationships between the main diagnosis, main problem with other mental problems too. Okay, so when you have this problem, it can be just working together with other problems, so it makes big problem to your clients, and then you have to see the dynamics between those mental disorders your client have. Okay? And later on, I want to just talk about the mental disorder and spiritual problems or spirituality. Spiritual problems. That is kind of very tricky too. So if you don't understand the mental disorder and between, with the spiritual problem, um, like evil position, as I said, as I mentioned last week, and then it's going to be very hard for you and your clients to figure that out what's going on, and then you can give wrong treatments. Like some pastors are thinking their church members have spiritual problems, but it can be schizophrenia. You can heal with spiritual power given by God. Why not? But it doesn't happen always. Okay. Then what? You're gonna pray. You're gonna just bring the person who got schizophrenia up to the prayer mountain and pray for 40 days, and I think it can make your clients worse, church members worse too. Because the person, your client, or the church member, whatever, has schizophrenia instead of spiritual problems. Exorcism, you don't just kick the devil out of your church member. Some pastors try to do that. I think that works. If those pastors have power, spiritual power, given by God, not by himself, not by themselves, or by some other things, then what? That's useless, right? So we need to be careful. Mental illness diagnosis. If we don't know, we cannot provide proper pastoral counseling. Pastoral counseling is not chatting, in a table with your church members or clients. The pastoral counseling has goals, and you need to approach with more professional way rather than only biblical approach. I'm not saying biblical approach is, whatever those are, but they powerless or something. I'm not saying like that, but for the pastoral counseling, you want to have more professional knowledge and training, so you can discern what kind of mental disorders your clients or your church members have, and then you need to change or set a plan for the treatment or helping for the better health. Okay, it's not just chatting. Well, some people can get lots of encouragement and comfort from you through the conversation, but if that is all, then what about the pastoral counseling? So for the better pastoral counseling, we needed those kind of tools. That's what's called the methods. Okay, and then we need to have a theological method for pastoral counseling. Then you need to know what's going on your clients or church members, so you can find the right track to help those people. Okay. It depends on the diagnosis. Pastors need to work with psychiatrists or counselors and medical doctors because mental disorder holders have lots of them. I'm going to show you that lots of them have physical problems too. Okay. and they have daily, just regular daily life problems too. That's why we want to work with other professionals like medical doctors, psychiatrists, counselors, police officers, social workers, okay? Unless we can be very limited. Even psychiatrists can be very limited if they don't have any other networks, whom they can work with. Because patients have lots of help from various angles. So sometimes psychiatrists need to ask help from to the patients' families and relatives or teachers and friends, girlfriends, boyfriends, for the better health. So we are, medical doctors, psychiatrists, counselors, pastors, people are there for helping people. So they need to work together for solving those problems and help those people. That is a way of securing our society too. Because our communities can be affected by those mental illness holders too. Because once they got, wrong, and they can do something wrong, and then they can harm the community too. Not only their families, but their neighbors. Okay. We don't call normal people sex offenders, for example. We call those people as sex offenders because they attack others sexually. And it can ruin other people's life. And it can leave lots of traumas to the victims. And it's kind of ruining the community. Because the victim has families, relatives, and neighbors and friends. Well, that is a different story. But when you passing by some streets, usually near the intersection, I saw recently one spot that's across the street, Carver and Maine. At the corner of that, there were lots of candles and flowers, which means a person or some people died on the street with traffic accidents or gun shooting or stabbing by crazy people. So they want to just remember their love, so they just lit a candle on the street. And they just stay there and pray there and just try to think, recall the good memories, the victim. How many people can be affected by one person's incident? It's the same to, it's not limited only to traffic accidents, but to many other things. Mental illness, sexual offenders, alcoholics, gambling addictions, anger management disorders, depression, schizophrenia, You name it. You name it. Those are ruining our communities. For securing our community and individual people's well-being, we want to work on those people, and we are taking care of those mental illness, and we want to just find the best ways we can do as pastoral counseling. I mean, through the pastoral counseling. Okay? Some mental illness can be related to or mimic a medical condition. Yeah. Therefore, mental health diagnosis typically involves a full evaluation, including a physical exam. This may include blood work or neurological tests. When our hormones got, go crazy, we go crazy. For example, menstruation for women, they have physical, it's not problem, that's natural, but physically they feel, something different every month, and they feel, and their emotions and mentally they got vulnerable sometimes. It depends on, the people. Some women they don't feel anything, so they just live the normal lives. But some women they got stomach ache or the ache at the bottom, lower body part, and then they feel something very weird. So they are saying they are going crazy, and some people do shoplifting because of it, seriously. Then, so physical, I can't say there's a problem, but the physical reasons, our mental, our mind and our mental, they can produce our mental disorders, mental illness. That can be, well, usually those are temporal, okay? Those are temporal things, but what if other physical problems? It can affect those people's life for a long time. What if you got cut in one of your hands? That's kind of scary, right? But some people are living without one hand or both hands or both arms and both legs or one leg, so one foot. Then, do you think they can boast, oh, I can live, you see, I don't have one arm, but I'm living great with one arm. I'm so proud of my one left arm, or one right arm. It's hard to see those kind of people because losing an arm, it affects the person's life, and the person can have, feeling miserable. Okay, so mental disorders, you want to just think about many things. You want to ask any physical problems or hormone problems or any injury. PTSD, post-traumatic syndrome. You watched this on a traffic accident. Actually, I watched one. A huge bus ran over a little boy. And I watched clearly how the little body hit by a big wheel, the front wheel, and the body just rolled down to the back, and Well, that's happened when I was in junior high. So I was biking and I biked to a police station really fast. I think that's the time, that's the moment I push the pedal the most fast moment. And I called a police officer and I followed the police officer with my bike again. And I saw kind of a thick blood on the street after an ambulance, um, took care of the little boy's body. I still don't know whether the boy died or not. Probably died because of the big wheels. Not only one hit by once, but rolled down to the back. And that was very traumatic for me for a long time. And I still remember that after 30 or 40 years. Well, that does not affect to me, you know, honestly at all at this point after 40 years. But what if that trauma made in me? I mean, what if that accident made in made me a PTSD and I can't drive or I can't walk and cross the streets? Then I have a phobia, PTSD, right? But what if I just shake my hands because of the trauma? Okay. What if I cannot walk even though my legs are okay? But that is the mental. A mental problem makes my body don't cannot move. And if you cannot move your legs, that makes you your mental that can produce your trigger your mental disorder too. Okay, so those are working together. Okay, my mind is okay, only my body is bad. It doesn't work like that because we are one. Okay, this is one. Spiritual, spirit, mind, and body, those are one. Okay, it's not separated. So those are all connected. So if you want to see what's going on to your clients, then you have to know what's going on your client's body, mind, and spirit too. So that's why it is saying this may include blood work. What if your client has diabetes or heart problems or liver problems? In the acupuncture area, if you have a liver problem, you are more prone to anger. So that's why it is saying neurological tests they need. You need to have your clients to take a neurological test too. See, those are all connected. The diagnosis of a mental health condition helps clinicians to develop treatment plans with their patients. Yes. You know what's going on to your clients, and then you can set a plan for treatment, for better counseling, for better physical treatment through the through the medical doctors. Okay, or you can work with other pastors too. However, the diagnosis of a mental disorder is not the same as a need for treatment. This is kind of tricky, so I want to read it again. However, the diagnosis of a mental disorder is not the same as a need for treatment. You know what's going on, but your treatment can be varied. Need for treatment takes into consideration the severity of the symptoms, the level of distress, and extent of disability associated with the symptoms, risks and benefits of available treatments, and other factors, for example, psychiatric symptoms complicating other illness. Okay. So what kind of treatments you want to try? And you know, dosages. You have a minor pain. This is what it is actually. When I have a minor pain, I usually take Advil. Well, I prefer Advil to other things, but I usually take Advil just one pill. But if I have kind of a little bit heavy pain or sores or something like that, I normally take two. But I don't take more than two. My friend, one of my friends, he takes 3 or 4 once. Okay? And when I take 1 or 2 pills and go to bed or take a rest, I'm usually fine after 2 or 3 hours, or after the overnight, after the sleeping. Well, when I feel really bad or I feel pain or something like that, I almost always try to go to bed after taking edibles. Okay. I haven't had any other medicines for last many years except edibles. So I have kind of a big bottle of Advil. I bought it from Costco and I use it until the expiration date. But my friend, he takes 3 or 4 pills and then he takes another 3 or 4 pills after 5 or 6 hours. If I have more pain after the sleeping or after the night or after 6 hours, I would take 1 or 2 pills again. Then what about the mental illness? What kind of a treatment do you want to provide? You want to see the level of pain. I mean, level of symptoms, level of stress. Okay. You want to see what kind of disabilities are happening. They cannot work. They cannot cross the street, or they cannot resist without drinking, or they go out and they don't want to come home and they sleep on the street even though they have homes. Depends on the level of the symptoms. Your treatment plan can be varied. Okay, it's like subscribing. You have a plan. You just have a plan. Depends on what kind of mental illness your clients have, and depends on how severe those symptoms they have. That's common sense, right? It's common sense. What kind of risks your clients can have if you provide this treatment or that treatment, right? So there are some things we have to consider. Each person is unique and may express or describe mental disorders in different ways. Yes. Some people can say melancholy, some people say they are depressed, some people say they are helpless, some people are saying they are sleepy all days, or some people are saying that they are kind of, it's like foggy in their head. What does that mean? They feel they have fog. Their brain is foggy. Well, they have many. I mean, what about the kids? Little kids got depressed, and for example, how are they gonna explain their symptoms? Okay. The level of distress and effect on daily living are important considerations in diagnosis and treatment. Yes. Okay, they have these kind of symptoms, so you want to diagnose them as depression. But yes, you have those kind of problems. And what about your daily life? Do you go to school every day? Do you work every day? Can you take care of it? You take care of your kids? I mean, can you drive right? And but usually, not necessarily, but when they have mental disorders and symptoms, it's going to be very hard for them to have their daily lives. Well, if you have when a guy has gambling addiction, if the guy works 5 days, 40 hours, 5 days a week, but he goes casino on Saturday and Sunday, I think it's okay. But it is gambling addiction. It's addiction. It's okay for making money, and it's not stealing money for the gambling. So he makes money for gambling on Saturday, Sunday. It's okay. I mean, it's not okay. It's addiction, but it's okay rather than stealing or threatening his wife, to get money, or threatening his parents for the money to gamble. It's okay rather than those, but still, what if the guy has a family? What if the guy has kids to take care of? What about the money? Well, usually people lose money for gambling, right? Majority of people are losing. Chance-wise, all people are losing their money for gambling, but they do gain for their luck. It's scientifically and mathematically, all people are losing their money. I don't know how people are making money from gambling. You see some people got lotto and jackpot in casino, royal flash rate. I don't know if that is the highest one, or what about 4 card? But those are happening like 1 in a million, and more than that. I mean, less than that. Okay. But we want to just see, all right, you have depression and do you do your regular life during the days? Well, that is kind of important. Alcoholics, they usually don't do anything but drinking because they got addicted. They drink every day, every meal, between the meals, right? So their brain, they want to just keep their brain drunken. There's some reasons, and they cannot make money. Actually, they are losing their money, and they don't have money. They beg for alcohols. They just beg for drinking. They steal for drinking. They kill and hurt others for drinking, and they just end their lives because of after the drinking. Maybe some people are living for drinking, and we want to just see what's going on in their daily life, um, and then level of those symptoms and how those symptoms can affect their daily lives is kind of important that we want to watch. Mental health and culture. People of diverse cultures and backgrounds may express mental health conditions differently. Yes, for example, some people are more likely to come to a healthcare professional with complaints of physical symptoms that are caused by a mental health condition. Some other cultures view and describe mental health conditions in different ways from most doctors in the United States. So, when you have clients from different cultural background, you need to be careful to diagnosis too, because their way of expression is different. Okay. It's kind of funny that if you want to ask some food, nice food and drink or chocolates, candies to Korean, in Korea, the people usually say, I'm okay. Then in America, you can ask, you want candy, and when you say, when your friends say, I'm okay, and that's okay, and you eat it. But in Korea, you ask a candy to your friend, and in most cases, your friends or your visitors gonna say, no, thank you. But you better ask 2 more times. It's ridiculous to ask 3 times, but usually, no, you wanna just have this candy. This is good. They're gonna say no. You wanna have this candy. It's good, and they're gonna take. All right, thank you. So their first to know things means asking me 2 more times. What's something like that. But in the United States, people usually don't ask, their friends or the visitors to have food or candies, chocolates. Maybe they can ask once, but there are chocolates you can enjoy, and they just eat it if they want to eat, and if they don't want to eat, they don't. And you are not supposed to ask, this is chocolate, this is good, you better eat it. And then you don't want to do that, and they don't do that. And even in Korea, if you have a bag of chips, you eat it by yourself when you are with your friends or people you know. It's kind of rude. You have a bag of chips, you are supposed to share that with your people. Okay? But in the United States, my kids eat, their chips while their friends are watching. I mean, they are saying, this is my chip. This is my chip, so I want to have. So I got it. Why am I supposed to ask my friends or people I know, to have some chips? It's different. It's different. Okay. I mean, so cultural difference can be challenging to you to counsel and for so you better understand their culture and culture that if you don't know that, you better ask them, what they think and what they feel when you just say or ask this and that. You better ask. Just don't preach, don't assume what they think and feel. If maybe little part of it, but you don't know them all. Okay? You can think you know them, but you don't know them. Because you didn't use the culture. You are not in the culture. Okay? Maybe you were in the culture for a few days or a few months or a year, but you don't know the culture, right? So don't assume what they think and feel, but ask them and study their culture for the better counseling, for the better treatment. It's not shame for you not to know them and their culture. You don't know them. It is natural because you are not belong to the culture. But it's gonna be shame for you if you don't study their culture for before providing any treatment for your clients because you're professionals. You have responsibilities. If you don't want that, maybe some counselors and psychiatrists, they don't want to just think about that and they don't ask me, but just do what they want. Well, you can do that, but for the better counseling. For the better counseling, you have to ask them and you need to study them. Or you're gonna miss some or really huge part for the treatment. And it's gonna be shame for you. It's not your client's responsibility, but your responsibilities as professionals. That's why we are called as professionals. Mental health and religion spirituality. Oh my goodness, that's kind of a huge part. A person might express to either a clinician or more likely to a faith leader experiences, such as receiving a message from God, punishment for sin, a calling to a great holy cause, possession by evil spirits, or persecution because of a conviction of a spiritual closeness. It is important to distinguish whether these are symptoms of a mental disorder, for example, delusions, auditory or visual hallucinations, or paranoia, distressing experiences of a religious or spiritual problem, or both. Mental health and religion, spirituality. If you don't understand what is spiritual religion-related problems like demon possession or evil possession, with especially schizophrenia, because schizophrenia clients they see what others cannot see, and they hear what others cannot hear, because that's not real sound or voice from real people, but that's kind of a part of hallucination. Then it can be tricky to see the difference between evil possession or listening to God's voice? Well, you can, as Christians, you can hear God's voice when others cannot hear. Okay? Because God is talking to you, not to others. That's what happened to Samuel when he was young. But the priest Eli, he couldn't hear anything. Well, both the little Samuel was a boy, and the priest is supposed to hear God's voice, but the little boy heard a voice from God, and there was the kind of a prophet that Eli's gonna die, and he's to pervert sons, two two sons that were disobeying, even blaspheming God, so they're gonna die, right? Then, what if the priest Eli told Samuel, you got a schizophrenia? Then the priest couldn't accept those stories from Samuel, what God spoken to Samuel, right? So it can be very tricky, and then you need to distinguish what's going on. You need to know what's going on, and you need to distinguish any spiritual thing with mental disorders. Okay. As I said last week, evil evil spirit possession is that's totally different with schizophrenia, but the symptoms are similar. They hear from God or from the Spirit what others cannot hear. But the schizophrenia people, they hear something that others cannot hear or see what others cannot see. Those are the same thing. But I'm not saying that you have to know which is which, but we can diagnose schizophrenia at least, and then we have some tools that we can see that is spiritual activities, okay? Then because through watching them and listening to them, and by medicines, because in this case medicine doesn't work, right? But this one, medicine works, because that's a mental illness, isn't it? And it does onset all at once, and it takes time. For healing, it takes time. For healing, it happens once. As soon as you kicked out the devil out of the person, if you can, then those symptoms will go away right away. But for the schizophrenia, it takes time. they can be healed. That's different. Excuse me. Mental health illness that may have symptoms with religious or spiritual content include psychotic disorders, for example, schizophrenia, schizoaffective disorder, mood disorders, for example, major depression, bipolar disorders, and substance use disorders, among others. Substance use disorders means alcohol, drugs, gas, bone, or something like that. Also, for a person of faith, having a mental illness may be seen as a spiritual concern or problem, just as having cancer or a heart attack would. Okay? Because of those, we need to be careful to diagnose what kind, certain mental illness or that's a spiritual problem. And if your client has involved with evil spirits, you better just work with kind of a sincere pastor who can just take the evil out of the person. I don't know if you can find them easily or not, or you can pray for your patients and clients. Anyway, you want to just work with those people, but what for this case, you want to work with psychiatrists. So, but at the same time, you can give counseling for these people and their families. But they need medicines. I think sometimes they are supposed to be hospitalized. Depends on the level of symptoms. And then as pastoral counselors, because you cannot provide any subscriptions except the 2 states in the United States, and so you want to work with the psychiatrists. But they need counselors too, because psychiatrists, they don't counsel people. They do little. But they need, the clients need, or patients need lots of counselings, especially their families. Because they have to know and understand what's going on, and they have something to do for their people, their families, who has schizophrenia. Or then that's why we are working together. Right? All right, and the connection between mental and physical conditions, that's crucial. Mind and body are connected. That's right. Who can separate them? In many important ways, problems that first affect the mind can later increase the person's risk for physical problems such as diabetes, high blood pressure, or malnutrition. Conversely, problems that first affect the body, such as a disease or an accident, can affect mental health. For example, emotions, thinking, and mood. That's right. Well, at the next slide, 68% of adults with mental disorders also have medical conditions. Yeah, because they have mental disorders, they don't sleep, or they sleep a lot, and they eat a lot, they eat less, and they cannot work, and because of the depression, or because of the schizophrenia, or obsessive compulsive disorders, anger management disorders, and other things, and then they have medical conditions too you need to take care of. So 68% of adults mental disorders, then they need medical care too. So you want to just work with psychiatrists or family doctors or other medical help you need. Don't hesitate that. I cannot take care of them all. Don't say that. You can't. You can't. And that's the reality. You have to know the reality. And 29% of adults with medical conditions also have mental disorders. It's kind of sad, but as I said, you don't have one arm or two legs or something like that. But at the same time, what about, many hospitalized patients? They lie on the bed, maybe whole day, in a nursing home, hospital for 1 month or 6 months, depends on the medical conditions, because they have to stay in there. Stay on their bed or in the hospital. They feel helpless. They feel they feel really bad. Do you want to stay at home or hospital? No one wants to stay in a hospital even a day. I don't want to do that. Well, who can avoid? Then they usually got hospital depression. Hospital depression. Because they are in the hospital for a long time, they got depressed. It's natural, right? It's natural. They can have a PTSD. They can have anger more. So they are vulnerable. They are vulnerable. So they can have mental illness because of the physical problems. Right. Adults living with a serious mental illness die on average many years earlier than other Americans, largely due to treatable medical conditions. Okay? Maybe they kill themselves. When their depression is severe, they're more likely, kill themselves. It's kind of sad, though. So when you hear any person, your friends or family, they say they want to die, and you need to be careful. They have more chance to die. I heard many people they want to die, but they never die. That's wrong. That's wrong. Be careful. Listen carefully. Don't tell them, you are joking. Don't tell them like that, but what's going on? What's going on? Let me hear from you. I'm on your side. Let me work for you. I'm going to be with you, right? Something like that. Do not, scoff on them, or do not say joking or whatever, because they are saying they want to die because something is happening. Okay? You want to take those kind of words seriously. Because they know what's going on in there, but they don't want to die. But they are feeling they want to die, or they have to die. It's sad. It's sad. But that's That's a happening. It's a happening in this world and in this time. Actually, depression is killing people a lot. So we have to know what's going on to people, and for the better pastoral counseling, you need to know how to diagnose mental illness, and at least we need to know what process they need for diagnosis, and what's going on to your clients. So we can set the better treatment plan for our clients and provide right treatment for them, because those are vulnerable. Right? So I think that's it for today. So I want to see you next week. Thank you.